Hello and welcome, everyone. My name is Jenny Beaver, and I'm the CEO of Fourth Trimester Arizona, a grassroots 501c3 collaborative of parents, families, health professionals, educators, and local organizations. We're on a mission to change the culture of parenting so no one has to do it alone. Thank you for joining us today for our second Fourth Trimester Ecosystem Lunchtime conversation. It's a mouthful, huh? As supporters of expected and new parents, today we invite you to collectively explore how COVID-19 has impacted maternal mental health for our Arizona families, including short-term and long-lasting implications. Go ahead and change the slide, Elizabeth. For those of you who may be less familiar with Fourth Trimester Arizona, I'll begin with a brief introduction of our organization. We connect maternal and child healthcare providers, social support systems, and parent support groups to foster collaboration, education, and to increase access to local resources. Our programming includes three main focus areas: our monthly village meetups for new parents, our annual Fourth Trimester conference for both parents and professionals, and lastly, today's focus area, our newly developing Fourth Trimester Ecosystem Initiative for all those who care for pregnant people and their families. All right. The goal of the Fourth Trimester Ecosystem is to facilitate inclusive conversations about what is working and what needs to change to better support new families in Arizona. And change the slide for me, Elizabeth. We expect our time together to flow something like this. Our intention is to spend the majority of our time listening to the speaker's experiences for about 25 minutes and discussing what we heard in smaller breakout rooms for another 20 minutes. Before we get started, if you want to go ahead and slide the slides over, a few key items to ensure everyone's able to fully participate. During the presentation, please post all comments and questions in the chat box. We'll be monitoring the chat and responding to your comments and questions. We also ask that you please remain muted, except for when you're in your breakout rooms. Of course, then please unmute and join the discussion. And we'd love for you to join on video too if you're able when you're in your breakout session. All right. Next, we request that you please enable your video again, if you're able. And lastly, we're recording the session so we can send you and everyone else who registered a recording of the session. So if you miss it, you'll have a recording. All right, thanks so much. Now on to the part we've all been waiting for. Today, we're focusing on the impact of COVID-19 on maternal mental health, and we'll hear from three perspectives in the following order: Anya Shante, a mother, Crystal Simpkins, a nurse, and Michelle Lacy, a counselor. We thank all three of you for being willing to share your experiences with each of us. For all of us who will be listening, it's helpful to consider that we all come from different maternal and child health focuses, yet we are all interconnected through the perinatal period and beyond. Please keep the following questions in mind for your breakout room discussion. All right, so without further ado, let's introduce Anya Shante. She's the mother of a toddler and expecting her second next month. Congratulations, Anya. We've been so excited for you. She's also a self-proclaimed family advocate and supporter who's passionate about mental health, inclusivity of all abilities, and her faith. As a woman who has weathered motherhood during a pandemic, Anya, please unmute yourself and go ahead and take it away. Let us know about your experience. We're so grateful to have you here today.
Hello, everyone. Can you hear me? Okay, perfect, because I'm having technical difficulties, so hopefully it'll stay where it's going. So I wrote a couple narratives for today, and that's just not my style because I like to talk from the heart. I'm a very authentic person, so I'm just going to share my story with you. So I am one of those mothers who unfortunately did not have the societal picture perfect journey into motherhood. I have stage 4 endometriosis. And so 3 years ago, I was actually told that I was infertile. I elected to have a exploratory laparoscopic surgery, which confirmed my endometriosis, and they told me that I would not be able to bear children. At that time, I was getting used to it. Just started the relationship with my spouse, and we decided to try. We only had to take medication. We didn't have to go as far as IVF, and we were able to conceive my son. When my son was 7 weeks old, I ended up in the ER because I was bleeding. My placenta was ripping from my uterine wall, and they told us that he had less than a 10% chance of making it. I was in so much pain. I was in and out of it, and Mark had to decide between myself because I have some health issues or our son, and we didn't know what a DNC was. Thankfully, by the grace of God, we decided to go home and check with our OB/GYN because otherwise my son would never be here. And that's where my perinatal depression and anxiety started. I was extremely fearful. Every single day I thought I was going to lose our child. So it was hard for me to connect with him, to even acknowledge the fact that I was pregnant. Um, and like I'm pregnant, right? Like you see these bellies, like we 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 carry some big babies. She's already like 8 or 9 pounds. So it was really hard for us. And no one ever talked to me about perinatal depression and anxiety, which in retrospect, I was suffering from. I could not acknowledge that I was pregnant. I could not do anything that we needed to do. I didn't want to do any of the kind of nesting. I didn't want to buy anything for our son. I didn't want to, I was just so consumed with the fear of losing my child. Um, and I apologize. I don't want to be triggering for the ladies who have lost a child because I know I cannot even imagine what your heart and soul must be feeling with that. It was really hard for me. And we had a super traumatic birth. Um, it turned out to be an emergency C-section followed by just a whole lot of that's where I actually learned about Black maternal mental health and the disparities that we actually have in our society because we suffered from that, right? So my spouse is Mexican. You wouldn't even know he has beautiful blue eyes, that change and everything. And we realized very quickly the difference between him communicating with our medical staff and him communicating with me and our medical staff, which is very unfortunate. Um, I suffered in silence for months. We had a rough transition. On top of all of that, we had to move out of our crappy apartment because the AC was broken. They didn't want to fix it. This is like August, right? Like super hot. Um, and so we were like living in hotels. Then when our son was 10 days old, I totaled our car, right? Because it's like, what else can we add to the mix? It just kept hitting us back and back and back and back, right? So at first I was like, well, life is crappy. Like anyone's gonna be sad, anyone's gonna be depressed. They have all these circumstances going on, right? Like, no, even the happiest person wouldn't be able to handle what we were handling. But then life started to settle down. We moved into our apartment, things got better, but I wasn't feeling better. I was feeling worse. And I decided to try to find some resources. And that's when I found out that insurance is such a huge barrier. I have not been back to work since my son was born, and I have access, and it's been such a huge barrier, right? Like you literally have to be dead or dying for most things. And so that was frustrating. But I was blessed enough to find support groups like at Honor Health Shade. They have a mom's group and they have a postpartum group, which was very good for me. And I was trying to go to therapy, which we'll save that for another session. But then I finally felt like I got into a certain place, and what happens? The world shuts down, right? And there's this thing called COVID, and you shouldn't go out with people and you can't talk to people. And there was that period of time where it was like nothing was virtual yet, right? Like everyone was just trying to figure out what is going on in the world. You couldn't touch anything, you had to watch your groceries, like all these different things. Then to make it even worse, our son was high risk, right? So man, I thought transitioning from a workaholic to a stay-at-home mom, having a rough transition into motherhood was hard. It was actually harder transitioning into what I call the pandemic bubble, right? So the isolation was so much harder. Not being able to utilize resources that I had found because no one knew what was going on was so much harder. Um, I actually had another surgery in the pandemic, which like shot my anxiety through the roof. Being fully transparent, I feel like I am codependent on my husband, and I'm very used to him being at all of my appointments with me. And he couldn't go to appointments, right? At first, it was just myself. And I was not used to that. And that was very difficult. And then we got pregnant, right? And then I was like, oh my gosh, like, what are we going to do? And it was a very scary time. It is a very scary time. And I will say, I feel so blessed because I actually attended the fourth trimester conference this year, hosted by this village of ladies, and it was life changing. Let me tell you. Through the fourth trimester conference, I was able to find out something called a birthing center. Now, some ladies know about a birth center, some don't. I didn't know what a birthing center was, right? I figured you have to have your baby at a hospital or you accidentally have them somewhere, right? Like you either have them in the home, the car, on the way to the hospital. I did not know there were these beautiful things called birthing centers. Then I actually had a conversation with Michelle, who's going to be talking, and she told me that there's actual therapists that specialize in maternal mental health. Let me tell you what a game changer it is to have someone who can actually help you what you're going through. I went to therapy and I would never feel better because it was like, well, your kid's 12 months. Like, you don't have postpartum. Like, it has to be something else. It has to be bipolar. It has to be OCD or what is agoraphobia. And I don't even have, like, I don't have a fear of going outside. I have a fear of corona, right? And so I was struggling. Like, I felt like I was utilizing my resources, but they weren't helping me. And through this conference, I was able to find not only a therapist that takes my insurance, but specializes in maternal mental health. I was able to find my birthing center who also takes my insurance. And on top of that, I am the June recipient of the Will-O-Wish grant, which is helping me with the facility fees for my birthing center. And we're having a completely different redemption birth, and I have a team in place that's going to help me decrease my postpartum. I don't think I can eliminate it because a lot of it is hormonal and I know it's going to come, but I feel like I have the resources and the tools. And I feel fortunate with COVID that we are still able to do things virtually, right? Because like we need help. And I know there's so many women out there that are suffering in silence. And some people don't feel comfortable on camera, or some people don't feel comfortable reaching out, like they need that in person. But I would say that's one of the benefits of the pandemic is that we are able to keep life still going, which for me has been great. Like and it's so crazy, right? Because like my toddler that day, like I barely made it to this conference, right? It's kind of like today, right? All my technology was not working. It was just one of those things where it's like you barely make it, but it's been so life changing. And I just want you ladies to know, like, yes, we are still in a pandemic. Things are getting better, but you should never suffer alone. It is better to sit and look at a screen and have someone listen to you virtually than it is to sit there in silence. Believe me, I know. There's one time that Mark came home, our apartment was a complete mess, and he found both me and my son crying in the closet, right? Like we were just like, um, and that was pre-pandemic because of everything that I was going through. And I think it's so important for moms to get the help that they need. Everything's so focused on the baby, right? Like you have all these appointments that center around the baby. And then what do you get? You get one postpartum appointment. And then it's like they screen you for postpartum depression or not. If you have it, they throw some Zoloft at you. And if you don't, they're like, okay, well, good luck with this brand new baby. Some people have twins, triplets, and they're like, they don't come with manuals or instructions. And I know for us, we don't have any family out here. So it's just us three, about to be us four, and it's a very difficult time. And I just hope, even on your worst days, that you still reach out to someone, whoever it is, because it will consume you if you suffer in silence, and it will be harder to treat. And I don't want anyone to ever go through what I've been through. And those were just the highlights that I've shared. We've been through so many different things, and I am now so passionate about sharing my story, but also hearing other mothers' birth stories, because they need to be shared so that we have a more realistic view of what motherhood is. And for those mothers that feel like they can't relate because they didn't have the perfect pregnancy or the perfect journey into motherhood, or you even feel like you're still struggling, whether you have a newborn or your child's about to go off to college. Like, I just learned about the reality of an empty nest, right? So I really hope that if any of you ladies are struggling, you can always reach out to me. I'm always there to share resources with you and my story. And I'm a very open, raw, and authentic person that will never judge you, because believe me, from someone who suffered from depression, anxiety, and borderline psychosis, like, and not knowing what's going on with my body, I really think it's important for every single parent to at least have that one person that they can ask whatever question to.
Thank you so much. Oh, Anais, thank you so much for sharing with us so much, and being so authentic and real with us about how it really was. We've so appreciated you just in general as a person, and hearing your story even more so. Thank you so much for being with us today. I really appreciate it. Sending you love and a hug. You brought tears to my eyes. All right. So now we're going to hear the experience of Crystal Simpkins, a registered nurse since 2016 and home health visitor with Nurse Family Partnership here in Maricopa County since 2018. Prior to joining the Easterseals Blake Foundation, she worked in the Level 1 Trauma, ICU, and NICU at Banner University Medical Center and has been actively involved in a local nonprofit that supports pregnant teens. She also has a passion for helping and educating first-time moms and loves learning from the families she serves. Crystal, I welcome you to unmute yourself and share your experience with us as well. Thank you.
Hi, everyone. So thank you for the introduction. Like Jenny said, so I'm actually in Tucson, Arizona. That's the only thing. But yes, so I am here with Nurse Family Partnership, which we are a community health program that helps with empowering first-time mothers to have a healthy pregnancy as well as a healthy baby. So we work with them from pregnancy up until their toddler turns 2 of age. Then they graduate our programs and we refer them to any other community health program that they would like to continue with. And so Anais, your story is just empowering, and one of many that unfortunately I heard with my own patients and clients that I visit, or now telehealth or remotely. So like you said, that was something that fortunately we were still able to offer them. We could no longer go into their homes. And with the pandemic, with that hitting, it was just so much unknown. So in our program, we have certain forms or assessments that we conduct. So one is called a generalized anxiety syndrome, and another one is a patient health questionnaire. So they're both regarding anxiety and depression, exactly what you were talking about. So we have certain timeframes where we conduct those assessments. So we start usually in pregnancy, then we do it once before the baby's born, and then throughout they continue in our program, because we like to make sure that if we see those scores starting to increase, we have the resources and any other help or support that we can provide for our patients and clients. And so one thing that I noticed with the pandemic, just because of so much unknown, a lot of individuals unfortunately started losing their jobs, family members having to attend appointments on their own, especially if things that were going on and they couldn't have that support there with them. I started seeing those scores increase. And with them starting to increase during the pandemic, one thing that we kind of started seeing the lack of was resources. Unfortunately, a lot of our resources were starting to close down because some of the organizations that we work with, their staff is mainly volunteers, and so they didn't have the staff to continue providing the resources. They also couldn't navigate a healthy way, a safe way to provide their services to our clients, just because, like we're saying, we just didn't know what was going on with transmission and how the symptoms were kind of occurring. So one thing, you kind of hit the nail on the head, was virtual support groups. So I kind of got together with our team members and we collaborated and we just kind of brainstormed. We reached out to different resources to see exactly what could be provided. So virtual, better than nothing. So we started seeking those and providing those to our clients and letting them know that exactly what you said, maybe that might not be the best. They prefer to be off camera, but as long as they're there, as long as they're hearing other women's stories, knowing that they're not alone. They're not alone in facing the unknown, that they also, there's other women that are dealing with the same situations that they're going through, and understanding one another. And I thought that was one of the best things that could have happened and come out of the pandemic, to be quite honest, because I have a lot of clients that unfortunately don't have the transportation to go to an in-person support group. So the fact that, these communities or resources were providing, virtual ones that they could just log on their phone, keep their, video off and just hear stories and share as they felt the need. It was, I will say, one of the best things that came out of this pandemic. And I just truly hope and that it continues, because, like Anise was saying, it's better to go through it with other individuals than just sit there alone and, feel that you are alone. I feel like that's the worst feeling you can ever feel. So I'm really grateful for our program, that we can continue finding resources for our clients to help support them, as well as the assessments that we're able to use to be able to notice those increase in scores, and knowing that something is going on and trying to get to the bottom of it and help them, support them along their journey.
Thank you so much, Crystal, for sharing your experience. Yeah, I think it's really interesting to hear what you have to say about virtual, for sure. I think it was one silver lining, that came out of the pandemic. Thank you so much for sharing your experience. And yeah, I'm interested to hear in our breakout sessions if other people had the same experience as you. Thank you. Yeah. Okay. Now we will hear from Michelle Lacy, licensed professional counselor and certified in perinatal mental health. Sorry. She is a founding member and the executive director for Women's Health Innovations of Arizona, a licensed outpatient treatment center and nonprofit organization specializing in maternal mental health care. Michelle received her master's degree from the University of Arizona in rehabilitation counseling and has been practicing since 1995. She has actively improved the landscape of maternal mental health care here in Arizona through her longstanding involvement with Postpartum Support International and the Arizona Postpartum Wellness Coalition. Want to go ahead and unmute yourself, Michelle? We'd love to hear your experience.
Sure. Thank you for having me. And thank you, Crystal and Anise, for sharing your perspectives. Anise, you nailed it. I feel like we don't even have to speak after you spoke, because what you described is exactly what we saw in our clinic. We saw moms going pre-pandemic having to deal with their birth trauma and mood struggles and getting into the care, and then all of a sudden everything being disrupted. And for us, we one of the things that we value is we come from a trauma lens. And so all of our therapists are trained in best practice trauma treatment. And what we found was there was a disruption we were moving in that, and then there was a disruption because we had to transfer to telehealth. And some moms didn't want to do that trauma work over, over Zoom when other people were in their home. The other thing we did see also was an increase in numbers, and that's what we're seeing in the data, right? Like we're seeing about 1 in 3 versus 1 in 5 to 7 moms suffering with a perinatal mood and anxiety disorder. And we saw the need for connection. I think it's important to remember that pregnancy and postpartum are one of the most vulnerable times for a woman in a woman's life. We have to consider the hormone changes, the sleep deprivation, role transitions, the identity challenges. And then you add in a pandemic, which also brings in the unpredictability similar to that perinatal period, role changes, increase in stress hormones, and then that lack of social support. And you think what we saw was mothers and parents carrying a load like they've never carried before. And the pressure was overwhelming. Our response was to increase that connection as best we could. So we partnered with Hope Women's Center, Hushabye Nursery, Maggie's Place, Dignity Healthcare, PSI, to implement support groups. And with our partnership with Dignity, we had groups almost 5 days a week at one point. We created some therapy groups, moms versus quarantine, moms during quarantine. We added an essential workers group. We added DBT and increased our bilingual services, because we wanted to be able to recognize that moms and families need all kinds of support. There's not a one-stop shop, right? It's not one thing fits all. So we wanted to ensure that moms and families were getting the support that they needed. One of the other things we saw was concerns, like a lot of anxiety around parenting and the impact on their children. And so we added a circle of security group as well, because I agree with everyone that's talked. We needed connection. And one of the things that we really value is that we want to ensure that access to care is available. And so we've used our grant funds or donor-driven programs, and we try to build everything, send it through insurance or the access funds, anything we do, because we don't want to turn a mom away, because nobody should suffer in silence. One of the things that got disrupted for us was we were at the bedside at 2 of the hospitals here in the Valley, and that was to allow for a warm handoff. Moms who were identified at risk, we were trying to avoid moms falling through the cracks, and that got interrupted, obviously, but we got creative with social workers at the hospitals, and we were doing virtual bedside support so that we could kind of still have that warm handoff, which was really important, I think, for however we can reach moms and families. And the biggest thing we saw was moms experiencing almost more symptoms of trauma, so hypervigilance and maybe even re-experiencing an intense anxiety as a result of maybe everything being interrupted, not having the social support they needed. We had many moms who had to deliver by themselves because they didn't have family members to take care of older children. I had one mom experience a traumatic birth and then a complication with her baby. And she did it all alone because her husband was at home with her other children, because family members were afraid to come and afraid of the exposure. So the level of trauma that families had experienced through COVID and the isolation is really important to recognize. We don't want to minimize that. And the other thing we saw was just disrupted peace and predictability. Nothing was, and that comes with new parenthood, right? So then you add that, then coming with with COVID, and it's been a very unsettling time. So we've seen that heightened anxiety. We also, for us, we have a lot of parents, moms who are pregnant and postpartum, who are also medical providers. And so now,
Hey, Megan, somehow we all got bumped into breakout rooms early. I know.
I am so sorry. I was trying to send Michelle a message and I clicked the wrong button. I'm so sorry.
It's okay. Technical difficulties. We'll pop her back.
Okay, yeah, everybody's
Something happened.
I'm so sorry.
Can you send a message to the breakouts, Megan?
Yes. They're coming back in 2 seconds anyway. They're automatically being brought back.
Okay. Okay,
I'm
great.
so sorry. Oh my gosh.
You're doing amazing.
It's all good.
so were you hearing me?
We got a little bit interrupted there.
Okay.
So everyone is being pulled back from breakouts. I think they're all back
Okay.
now.
Somehow
Yes.
something automatically happened. So yes, but please continue. Yes,
Well,
we're
and
almost
so
all
that,
back now, I think. Yes,
that's a
I
great
think we're all back.
example. That's a great example of technology. So that was a barrier for some, like they didn't have maybe access to technology, or their technology was not great. And so then we had some barriers there, but we believe in just being as creative as possible to ensure that moms are connected and we get and they get support. Biggest, I was telling the breakout room I got into, our biggest thing was telehealth has been a blessing because we are now able to meet the needs of moms across the state. And because we're one of the few that bill access that specialize in maternal mental health, we're being able to meet needs, a greater need that has been very much necessary in the state. We also, we will continue telehealth because some moms just don't have childcare, and this is the way they get connected. We will continue our groups in person and in telehealth for that reason as well. The biggest thing I would like people as practitioners and people working with pregnant and postpartum women is recognizing the impact that the pandemic has had as far as assessing for trauma. Because trauma is not just the tornado that takes out a town or the earthquake. Trauma is in the eye of the beholder. And so what I believe is traumatic and what you will be very different, but I will have a sense of horror and overwhelm, and I will have a fear of something bad or death happening to myself or someone I love. You think about being in that vulnerable position and having this little baby and not being sure about this virus. That's a significant thing we've also seen. I know I'm probably out of time, Jenny, so I want to honor. Oh, no. Okay. So I think that's the most important thing is assess for trauma. If you don't know what trauma looks like, let's talk about it so that we don't miss it, because oftentimes we will have moms who are experiencing anxiety and maybe even numbing, which is a symptom of that, and just not get it, not get the treatment that they need. And really what it's about is it's trauma. And the virus, what we've seen, has definitely increased that. I think I connected off when I was saying we have moms that were medical providers who now were going through the normal transitions with perinatal mental health, and then the virus, and then witnessing everything they did. And I had one mom share, and I will end with this. I can't be the medical provider that I once was because she was in an ED. And it hasn't been like the norm. And so she had to redefine that role as well of, well, who am I as this medical provider, and look at how she could be just present. Oftentimes she was just present with people when their families couldn't as they passed. That's a lot as I said, I think moms and parents are carrying a load they've never carried before as a result of what happened. And the beautiful thing is we are coming together to provide as many resources as possible. And I also have to plug Postpartum Support International, because they have over 18 virtual support groups, a helpline. I know Pam is here. She's the PSI Arizona chair. And then, of course, fourth trimester, you've done just incredible in providing that connection. And so I think the collaboration together has been just a blessing to families.
Thank you so much, Michelle, for sharing your experience. I think, my youngest is 6, and so I wasn't exactly in the close perinatal period, but I think, many of us can probably identify with just not knowing what to do and not knowing if you're doing it right. And also just feeling like, oh my gosh, how much load can be put on me? Like, how much more can I possibly take? And it just kept getting bigger. So I really appreciate you sharing your experience and the trauma informed lens too. I think that's a big piece that we're all going to need to really get caught up on as we move forward past this pandemic, both for pandemic issues and just in general. All right. Well, thank you so much. We appreciate each of you, Agnès, Crystal, and Michelle, for sharing your unique perspectives. We acknowledge that each of us may have had different experiences than those we've heard today, and that is totally okay, and we honor that. At Fourth Trimester Arizona, we believe that informed choice is key, and we are in no way attempting to promote any one choice over the other. We have a brief question and answer session before heading into breakout rooms. Elizabeth, would you mind sharing any questions from the chat?
I would love to. Thank you, Jenny.
Yeah.
We have a wonderful question here from Amy from Nurse Family Partnership and Easterseals Blake Foundation. And I think this is directed more at Michelle because it popped up when you were talking. So it says, what is the best way for us to connect families to your telehealth supports?
Sure, and I'll put it in the chat, but our intake line, it's intake@whiarizona.com, and I'll add it in there, is the best way to connect. And we have Christina who responds very quickly. We also have our, our phone number. We can leave messages there, but the intake line is probably the best.
Wonderful. Thank you so much, Michelle. I think there's another question, I believe it's also for you, but how do moms get that direct bedside support after labor and delivery?
We provide that support through the Dignity Hospitals, through Mercy Gilbert and Chandler Regional. Right now, as I said, we can get it virtually, which is not quite as ideal, but it depends on the hospital that you're at. But there are other things you can do if your hospital is not doing that. The PSI helpline is a really good resource. You can call from that, and you will speak to a trained volunteer and a professional, and they will connect you to also local resources. And it's just an amazing resource and available because they know maternal mental health, and that's something you can do right from the hospital, and they will connect you to those of us here in Arizona who can get to give you all that you need, so that you don't have to fall through the cracks.
Thank you so much, Michelle. Are there any other questions? If not, I'm looking in the chat for them too. So if you have questions, feel free to pop them in the chat. If not, I think, Jenny, it's time for our breakout sessions. Is that correct?
Yep. Time to shift to breakout sessions for deeper discussion. Elizabeth, if you want to set the stage for us so they know what to expect.
I would love to do that. Thank you. Thank you for this discussion, all of our presenters. I'm just so happy to hear so much on this topic. It is such an under-discussed and over-needed, especially in the pandemic. And every single one of you have brought just such life force to this, and your passion shows through from the experiences you've had and the heart that you give. So thank you. So in the breakout sessions, we're going to pop off of Facebook, and we're going to head over in the next 20 minutes to our breakout rooms. You got a little taste of that earlier, so we'll be popping back there.